everywhere. I'm their media contact, and I do podcasts for them and TV, radio, everything that comes along. I'm a senior teacher, teaching faculty at Center for Education and Development of Homeopathy, which is the biggest homeopathic teaching course in the world. We're in multiple locations in the US and Canada. We are all over Europe. Um, and so there's a lot of information that we can share. I've left lectured, as you mentioned, a lot of different places. One of the places I went to was VA, Miami, and VA was gracious enough to not only give me their grand rounds, but also um, sort of uh, use it virtually, having all of their VAs in the Miami area and the East Coast to sort of get in and listen to the homeopathy. And that was very important to go there. I've lectured different places. AMMG is one of them. A lot of what I do is, as I mentioned, webinars and seminars. Boron has there is a sort of a health care practitioner education site. I have a lot of information on there or webinars on there, and I recommend for those of you who would like to know more about homeopathy to sort of log in, sign in, and there's so many different informations there that you can use. CDH, this is a pre-COVID era where we had sort of in-person training all over United States, and I used to teach in Los Angeles, San Francisco, Philadelphia at times, and Fort Lauderdale. And post-COVID, we have gone through a Zoom transformation, and since then, as of last couple of years, in Miami, we're trying to bring it back, and we've brought it back to in-person. So our in-person classes are upgoing in Fort Lauderdale, Los Angeles, and a couple of other places. But CDH offers a course in person and also on Zoom. So if anyone is interested about homeopathy, I'll give some more information at the end as well. It's an 8-weekend class, which is 1 weekend a month. So it takes 8 months from November through June. And we offer 14 CMEs per session. So with the help of Dr. Halasa and chronic disease prevention and management, we are now offering these CMEs. And if you like to learn homeopathy and at the same time get your CMEs, it's a great place to be. The instructors are amazing. We have ophthalmologists, internal medicine doctor, family medicine doctors, dermatologists, pediatricians, family medicine myself, functional medicine doctors. So it's an amazing group of doctors who lecture as well as put out these webinars that you see on our own website. We also have sort of evening workshops where we just talk about one thing, like, I don't know, menopause or anything else that the doctors ask for. We're going to talk about homeopathic consultation. My goals are to give you an overview just for those who are not very familiar with homeopathy, and then talk about how we choose homeopathic medications, go over homeopathic constitution, and then give you some treatment examples, talk a little bit about FDA, and then some homeopathic research, and then I'll get your questions at the end, or you can ask anytime. For that purpose, I ask you to just have a different perspective at this point. The subjective objective assessment and plan does not work in homeopathy. It's a different way of approaching patients. So it's important to sort of see how it's different than a medicine as well. If we go back and look at sort of the timeline of medical arts, you see there's Persian medicine, and then before that you have Ayurveda, you have Chinese medicine, and then eventually you get to sort of homeopathy, a little bit later on naturopathy, a little bit later on allopathy, and then osteopathy obviously came after Mind Body Book, and then Freud afterwards, and chiropractic obviously was born out of osteopathy. So there is so that we see in time how things have shifted. The founder of homeopathy is Dr. Samuel Hahnemann. And Samuel Hahnemann was a physician that, just like A.T. Still, he decided that the treatments of the time, which were sort of mercury and ether and cutting things out and everything else, were a little bit crude. So he thought that there might be a different way of treating patients without sort of causing so much issues, sort of side effects for them. He sort of lived around the same time as Edouard Jenner. And if you appreciate, at the time, vaccines were sort of giving small amount of something to the body to stimulate the immune system had become the philosophy of the time. They were both obviously before Louis Pasteur. So the bacteria and the viruses and all that, although people knew that there is infection, the causative agents were still not out there. And so there was not a lot of information. So when we talk about Hahnemann, we talk about certain things he said at the time that were very important because he didn't have access to this future information that came. The origins of homeopathy are where Hahnemann, as a medical translator in a book, read that Countess of Cinchon was treated for malaria with Peruvian bark, and her fevers and chills got better. So he decided, like any other good doctor at the time, that he's going to treat himself, sort of give himself Peruvian bark and see what happens. And that we call approving, because he did that, and he figured out that as he takes the Peruvian bark, he starts having fevers and chills. So we call this section of medicine proving, which means giving someone a dose of a natural substance. And if you remember back in the days, we used to sit down next to the patient and say, oh, now he's sweating, and now he's breathing fast, and now his blood pressure is high, or stuff like that. So that we call proving. And so that you know a little bit more about provings, have been described as important in the development of clinical trials due to their early use of simple control groups, systematic and quantitative procedures, and some of the first application of statistics in medicine. So provings are very important. And then after proving in homeopathy comes experimentation. That means then we experiment to see if that natural substance in homeopathic dilution, does it actually work or not? Because, we can say anything can be diluted, but the question is, okay, now you got to dilute it, but does it do the job that you are expecting it to do? So if a natural substance in nature gets proven, and then we do experimentation on it, and it actually works, that means works in curing or treating the symptoms, we should say, in homeopathy, then it makes it to Materia Medica, which is the compilation of all the homeopathic medications that give us, we go back to, as homeopaths, and look at them to figure out a person's constitution that we're going to talk about, as well as other homeopathic medications that we use. I'm going to give you a little bit about Constantine Hering. He's very important. Obviously, you guys have heard of the law of cure. Those are all come from Constantine Hering. He was a very interesting individual. If you guys get a chance, look him up a little bit and study his past. He's an amazing person. But eventually he knew medicine. He has a very long history with homeopathy for a specific reason. And if we ever get a chance, I'll give you the story of that as well. He decides that he is a homeopath, and he proves to himself that homeopathy is amazing. And so he becomes a homeopath. And he is the person who brought homeopathy to United States. And he is actually the person who's done a lot more provings than Hahnemann. So he's done 91 provings in his time, and Hahnemann, the founder of homeopathy, actually has done 46. Hering was the first person to use nitroglycerin for headaches and heart conditions 30 years before it was used in conventional medicine. And obviously, conventional medicine used the provings of homeopathy at the time to sort of find nitroglycerin and use it for the specific cardiac reasons and everything else that it was used for later on. At a certain point, we started having a homeopathic hospital in the United States, 1833. And in 1835, Herring founded the first homeopathic institution in Pennsylvania, North American Academy of Homeopathic Healing Arts, which later merged with the Hahnemann Medical College of Philadelphia, which was a homeopathic school. There, Herring and his students treated over 50,000 patients a year and trained a total of 3,500 homeopaths. At a certain point, we have 22 homeopathic medical schools, including Boston University, Stanford, and New York Medical College, and 100 homeopathic hospitals, and over 1,000 homeopathic pharmacies at the time. Once you go to sort of look these tabulations, which are amazing, you look and you see that something like cholera, the mortality of homeopathic hospitals were 11%, allopathic hospitals were 63%. Another cholera, you see 7% as opposed to 31%. And then another one, you see 33% as opposed to 66%. Typhus was very important as well. Mortality was 2%, and in allopathic hospitals, it was 13%. So there was at the time, homeopathy was a very important part of our medical system. And for that reason, the statue of Samuel Hahnemann, the founder of homeopathy, is located in Washington, D.C. This memorial, well, skip through that, but the memorial was designed by Congress as a tribute to his influence on alternative medicine, making it one of the few monuments in the United States dedicated to a medical figure. So at the time, we sort of knew homeopathy, and we knew Hahnemann as an amazing person and homeopathy as an amazing part of medical treatment. However, with certain reasons and issues, things changed. And I don't want to get into that. Obviously, we can get into it if you want at a certain point. But let's say homeopathy sort of lost its mojo for a while, but we are bringing it back, and I've made it one of my passions and sort of goals to bring it to medical sort of institutions and to see how I can grow it back to what it was. Homeopathy, homeo stands for similar, and pathos stands for suffering. These are obviously diluted substances found in nature, which stimulate the physiology. One thing to know is supplements are not homeopathic. Obviously, your patients come and say, I'm using homeopathy, and then you ask them, what are you using? And they say turmeric. Turmeric is not homeopathic because it's used in its natural doses. There are three principles of homeopathy: the law of similars, like cures like; the law of highly diluted substances, the natural substances have to be highly diluted; and that illness is specific to the individual. The law of similars have been sort of referred to in medicine by Hippocrates, which is the father of Western medicine, by Paracelsus, which is the father of pharmacology and botany, and by Avicenna, who is the father of Persian medicine. So these people actually have referred to using similar substances to cure the effects. Highly diluted natural substances are what we use. Obviously, vaccines are sort of high diluted, sort of viral particles. And then if we think about immunotherapy, like if someone has allergies to cats, obviously what we do is we give them small amounts of cat dander and slowly get their immune system to get to a point where it can respond properly to cat dander. So that is also used in nature a lot, in medicine a lot. Then we have, which is very important with homeopathy, illness is specific to the patient. When a patient comes and talks about headache, and I love this picture specifically because of that, is because a patient can tell us that my head is hammering, or it feels like they're drilling in my head, or it's exploding, or it's expanding, or it's tight, or it's throbbing. So they give us different um, sort of ways of describing their headache. Um, if if you have ever worked in an urgent care, or even in obviously regular practices, if you use, let's say that night you're seeing three, let's say five sinus infections, and so the first one comes in and says, I have sinus infection, started with sore throat, I have green nasal discharge, and I have a little bit of cough, um, and that's that. And you give them their medication, your medication of choice. Then somebody else comes in and says, well, my nose is completely clogged. I can't breathe out of it. Nothing is coming out of it. I have pressure in my head. I bend down to tie my shoes and it's throbbing. All the symptoms of and signs of sinusitis. Again, you give them the medication of choice. And then a third person might come in and say, I have pain in my teeth and I have bloody discharge from my nose and sore throat. And again, you do your exam and you figure out that it's sinus infection. So in essence, illness is specific to the patient. Um, in allopathy, we do, or an osteopathy, obviously, we do a sort of nosological diagnosis, and we go from sinusitis to the medication of choice. In homeopathy, it's different. In homeopathy, we're looking at the patient who has the illness, the patient who has the disease or has fallen ill, and we try to find a natural substance in nature that in its natural doses will create those specific symptoms. Um, there are different types of homeopathy. There is classical homeopathy and there's clinical homeopathy. In classical homeopathy, homeopaths prescribe only one medication for the totality of the symptomatology of the patient. Um, and there are definitely lengthy interviews, sometimes 2.5 hours to figure out exactly what homeopathic medication. There are more than 1,000 medicines. Some of the medications are anecdotal, obviously. In clinical homeopathy, there is a homeopath will prescribe more than one medication. So if we have a patient who has sinusitis and has other issues, we might give them a medication for sinusitis. We might also give them other medications for other things to be treated. There are around 300 medications, and most of the medications are based on toxicology and pharmacology. So it's a little bit easier, and that's why I chose clinical homeopathy. Number one, it's easier to study. It takes time, but it takes less time to learn. However, you have 300 medications, and a lot of the medications are what we know because we have taken pharmacology before. So it becomes easy to figure out what each of these medications do. Not to say if is classical or clinical better or worse. I don't there's no judgment here. It's just the fact that sometimes people will tell you, oh, I went to a homeopath and it took 2.5 hours. And then they come into my office and in 10, 15 minutes, or sometimes half an hour, I have their answer. So there's a difference in the way we interview the patients. There's a difference in the medications that we use. So there's just difference. But the essence of homeopathy, which is like curing, like using the diluted natural substances, and knowing that it's the patient that has the disease and not the other way around, is still the basis of both principles. As I mentioned, in clinical homeopathy, substances have to be pharmacologically active and have toxicology, and they have to be very diluted doses. So I will send out this challenge, and hopefully you guys can figure this one out. Can you name some pharmacologically active natural substances that people use on a daily basis? And your answer, I know it's going to be one of you guys will pick out coffee, because whenever I give this lecture, someone usually picks out coffee. I'm a fan of coffee. I can drink as much coffee as you think I can, and I enjoy it and I love it. Coffee has certain, so when we look at a homeopathic medication, any medication, you guys most of you are familiar with arnica. Some of you guys are familiar with other medications like apis and lachesis and other homeopathic medications. But when we look at a homeopathic medication, we're looking at the natural components, the chemistry, the chemicals that are in there. And coffea or if it's close to the time of sleep, I won't be even be able to sleep because my mind is rushing and running and my body is physically active and I can fall asleep. So that would be the toxicology of coffee when we get to that point. And obviously, the more coffee, the toxicology gets worse. But so we use a Coffea cruda as a homeopathic medication for these specific symptoms that we talked about that coffee produces, which is anxiety, agitation, myoclonia, vertigo in some people, tachycardia or extrasystole, trembling of fingers, cramp of calves, polyuria, gastric acidity, migraines or headache, prolific flow of ideas, overexcitement, insomnia, physical hyperactivity, and hypersensitivity to noise. So this is sort of the pharmacology and toxicology of coffee. But so in diluted forms, we use coffea to get rid of these specific symptoms. And that's what we call like cures like, or homeopathy. So we're getting these pathos, which are the suffering, let's say the overexcitement, physical hyperactivity, which brings some of your patients or some of your parents bring their kid and they say, the nurse of the school has asked me to take my child to the psychiatrist and get evaluated because he's overexcited, he has prolific flow of ideas, and he has physical hyperactivity and he can't sit down in class, right? So one of my major medications for patients who come in with this symptomatology is coffea because it actually covers all of that. The other time I use it is when they have insomnia, and insomnia is because they got a bike and they're excited and they can't fall asleep, or they're going to Disneyland or Disney World and they're excited, they can't fall asleep. Or with adults when they go to bed and they have this flow of ideas. That means they think and think and think and they can't sort of quiet their mind to fall asleep. Coffea cruda is a major medication that I use for that reason. Um, so up to now, the point was to sort of bring you with a sort of to what homeopathy does, how homeopathy works, and everything else. And now I want to sort of start talking about the idea of constitution. I'm going to start with uh, some information on uh, temperaments. And temperaments are something that sort of made it to homeopathy uh, based on these four elements that you guys probably have heard of, the blood, the phlegm, the yellow bile, and the black bile. And they've given it traits, they've given it health strengths and health weaknesses, and so on and so forth. And this is what some people think is a part of homeopathic constitution. However, temperaments have been there since the ancient times. Hippocrates used them, Galen used them, Avicenna, the father of Persian medicine, used them. So temperaments are nothing new. And remembering that homeopathy started, with Hahnemann in the 1800s. So this was sort of going way back, and we don't think there is any relation to the two. When we talk about constitution, and I'm going to talk about constitution from a clinical homeopathy perspective, Because as I mentioned, constitution in uh, uh, classical homeopathy is all the symptoms that a person has and their behavior and their emotions and their likes and dislikes and modalities, which we call aggravation modalities and exacerbation modalities. So classical homeopathy brings all of that into account. We separated a little bit just so that we can have a little bit more understanding of each person. So in clinical homeopathy, we either go by elimination patterns or we go by morphology and connective tissue, which we call constitution, and or with sensitive type. And when we look at a patient, a person in front of us, we can actually see all of these things. And so it's not that we only use one or the other. We can actually see all of these things in one person based on everything that I'm going to discuss with you right now. So, elimination. Obviously, the most important, the most critical physiological process in the human body is elimination because it ensures the waste products and toxins and metabolite byproducts are removed. It prevents toxic buildup, maintenance of acid-base balance, regulation of electrolytes and fluids, removal of metabolic waste, carbon dioxide removal and immune detoxification, digestive waste elimination, hormonal metabolite clearance, skin detoxification, and it also supports microbiome balance. So elimination is important, obviously. It's given a lot of credit in homeopathy. Our elimination organs or tissues are gastrointestinal, genitourinary, pulmonary, dermatology skin, and obviously the mucous membranes. When we look at elimination patterns, we have multiple elimination patterns set forth by Hahnemann. So he talked about a psoric reactional mode, a psychotic reactional mode, and a syphilitic reactional mode. Tuberculinic reactional mode and other reactional modes came later. Tuberculinic reactional mode is a mode in the United States and Europe. I know that in India, they use more than this. There's more elimination patterns that they use, but we sort of suffice to this four. Knowing that the top three were the reactional modes that Hahnemann himself talked about, and tuberculinic was sort of added later on. So I'm going to explain psoric, psychotic, syphilitic reactional mode, and then I'm going to go and talk about tuberculinic reactional mode, which is actually a subset of psoric reactional mode, the first one. So the first one we call psoric, psychotic is not PSY, obviously, it's SY, and then syphilitic. So going to these elimination patterns. Oh, and then is there a relationship between the four temperaments and the reactional modes of homeopathy? I think some authors have tried to combine and sort of make references to these. But in essence, when we talk about Hahnemann talked about miasms, and he put psora, psychosing, and syphilis as the abnormalities that one could get. Psora, at the time, they thought that issues are related to either scabies, gonorrhea, or syphilis. So psoric was the abnormalities. Obviously, these are miasms. Back in the day, this thought process is no longer there, but we have noticed that the characteristics of individual constitutions have stayed the same. So Hahnemann talked about psora for scabies, psychosing for gonorrhea, and syphilis or syphilinum for syphilis. But in essence, he always said that individualization is important and no one is supposed to be pushed into one specific constitution or one specific miasm, and you should look at an individual purely as an individual. But if you can find a chronic reactional mode, it will only help you more with that specific patient. I'm going to start with the psoric reactional mode. In psoric reactional mode, so going back to elimination, there's two pathways. There is either we eliminate, or the second pathway, which will come later, which is psychotic reactional mode. That would be the pattern where elimination has become either blocked or has stopped. So if we eliminate fast, we're talking about patients who, they go to a restaurant, come back, they have gastroenteritis, the bacteria that, maybe was in the food comes out, goes away, and we're done. Or they get a sinus infection, they do the treatment, and sinus infection goes away. So it is almost a rapid and acute thing where you get exposed to something, body says, okay, now I got to use one of these elimination pathways to get rid of it. The body uses the elimination pathway and gets rid of the offending agent. So it's a pattern of elimination based on the use of elimination pathways that we discussed. So it would be gastrointestinal, they'll get a diarrhea, as I said, a vomiting or gastroenteritis, and then it goes away. Genitourinary, they might get UTIs, they might get herpes, yeast infection, fungal infections, kidney stones, same are considered psoric in clinical homeopathy because kidney stones come and they eventually go. Pulmonary, they have a cough, they get asthma attacks, it comes and then eventually it goes away. Dermatology, they get acne, molluscum, herpetic lesions, or contact dermatitis. On the mucous membranes, they get sinusitis, they get hay fever, they get vasomotor afflictions, or anything that comes and again leaves the body. So there is a resolution of the issue, although there are stages. There's the prodrome stage where they get exposed to it. There's an inflammatory stage where the body starts, dealing with the offending agent. There's infection. There can be heat or pyrexia if it's an infection, a local infection, or a systemic infection. There can be exudation or discharges. And then there's a convalescence stage, and then at a certain point there is resolution. So we know how long flu lasts and what the symptoms are, sinusitis, UTI. So we know all of those things, and we can sort of set them into these stages. The most important thing is that the patient gets back to a normal pattern of health. The issue completely resolves, and the patient returns to original state of health. So psoric uses the elimination pathway to push things out, and then we're back to normal. There is alternation of elimination pathways. That means this patient can have asthma, and then, a month later, 2 months later, they can have a diarrhea. 2, 3 months later, they can have sinusitis. So you see that they go from, let's say, asthma, which is the lungs, then they go to digestive, and then they go to mucous membranes or ENT, and then they go to genitourinary, and they sort of get rid of. So there is an alternation pattern. That means a person will not continuously have the same issue. They will sort of use different elimination pathways to get rid of issues. There can be a recurring pattern. Some of our patients will tell us, and they say, if every year around this time I get my sinus infection, or every season I get my migraine, or we have patients that say every month with my period I get a herpes, or right after my period I get a yeast infection, or every year around this time I get my allergies, I get hay fever or something like that. So in psoric reactional mode, there can be a recurrent pattern in some of the constitutional medications that we're going to talk about. There can be a recurrent pattern. There's a slow recovery. That means you will see that as time goes on, your patient started sinus infection or bronchitis with which was relieved by one antibiotic, and then next year one antibiotic, and then 3, 4 years later they took one antibiotic, and then it lingered, and then they had to have another antibiotic. So you will see that now certain things, as time goes on, we'll have our patients telling us that, things are lasting a little bit longer than they did before. It's sort of there a little bit longer. And then there is lack of good response to well-indicated medications. As I mentioned, again, your patient comes in and says, I had bronchitis and one antibiotic used to do it, and now I need 2 rounds of antibiotic to get rid of it. And this year I needed 3, and this is just becoming a little bit too much. So we know that as time goes on, the pattern starts shifting just a little bit. Um, so uh, this was our sort of psoric reactional mode medication, which is a pattern of elimination based on elimination pathways. There's acute elimination. The patient always comes back to normal, and they use different pathways to eliminate. Our medications for psoric reactional mode are sulfur, sorinum. Sorinum itself is the homeopathic dilution of scabies. Arsenicum album, I'm sorry, that's not an L, it's an M. Arsenicum album and lycopodium. These are the medications that we use most often for psoric reactional mode. I'll get to what each of these mean. Well, I'll get to what lycopodium means as so that you guys see what we mean by that. But I wanted to give you the name of some of the medications that we use with psoric reactional mode. So if you have John and Elizabeth, and this is 1 year from January through December, let's say John will have in February flu, in May he will have hay fever, in July he'll have a gastroenteritis, in September he'll have an asthma attack, and then in November he'll have a sinusitis. But every time in between, his health goes back to normal and nothing lingers around. Elizabeth will have herpes outbreak in March, and then bacterial vaginosis in May, yeast infection in June, contact dermatitis in August, and cough in October. But again, after each of those, Elizabeth goes to being the happy person that she is, that you can see on the slide. So that was the essence of psoric reactional mode. A person gets an issue, the body eliminates the abnormality, and they go back to normal and life as usual. Now we're going to switch modes a little bit and talk about the psychotic reactional mode. And this is a pattern of blocked or stopped elimination. So just in your mind for a second, imagine that all the elimination pathways that I've told you, if they get slowed down or if they get blocked, what are the things that can happen with one patient? As you do that, I'll drink some tea. So it is based on an insult to physiology or the psyche. The insults can be injections, medications, hormones, pollutions, and the psyche can be stress or emotional trauma. So your patient can come and here we also talk about the concept of etiology. In homeopathy, concept of etiology is very important. In medicine, it is as well. We always ask our patient, we say, when did it start? After what? But I don't know if in medicine we have a lot to do with after what. In homeopathy, we do. Once a patient comes in and says, oh, it all started after I had my, let's say, vaccine. I started having, I don't know, some thyroid abnormalities, or my IBS got worse. Or because they got too many injections, too many vaccinations, and their immune system got challenged a little bit. Or patients that we put on hormones, we have to be careful because these are in homeopathy considered foreign particles that we're introducing to the body. Medication, and we have some medications on, and my pet peeve, and I've talked about this in medical conferences, SSRIs, we start a patient with an SSRI and then we add another SSRI in 10, 15 years because the first one is not working. And then eventually we add a sort of mood stabilizer, and then we have to give him something for sleep. So So we see that medication and taking medication chronically and long term is going to start changing our patients. It can change them to a psychotic reactional mode. Being exposed to pollutions, being exposed to mold, to heavy metals, and other environmental toxins, obviously, a reason why someone might um, get a psychotic reactional mode abnormalities. Too much stress, emotional trauma. Someone might say, right after my divorce, um, 3, 6 months after my divorce, I started gaining weight, and now I can't lose that weight anymore, right? So this is for psychotic reactional mode, there needs to be an insult. So most of us are psoric reactional mode in nature. We have been born psoric in nature, where we, drink and cry and poop, and we get sick, and we get we get an ear infection or tonsillitis. So things will come out, and then we go back to normal. But at a certain point in one's life, something might change that direction of psoric reactional mode and push them into a psychotic reactional mode. Psychotic reactional mode is slow and progressive. Changes in physiology and morphology happen slowly without returning to a normal baseline. So patients do not come back to a baseline health anymore. They continuously get worse. Weight gain is part of it because remember, as you block the elimination pathways, what happens is toxins will stay inside, and the body will use sort of uh, adding hydration and sort of cellulitic infiltration to sort of try to modify that, which it does not happen, obviously. So weight gain is there usually without thyroid abnormalities. Caloric restrictions does not decrease the weight. Exercise does not decrease the weight. This is your patient who comes and says, I look at water and I gain one pound, right? So, but you've tested them and there's nothing wrong. There's no hormonal abnormalities or anything else. And then eventually cellulitic infiltration starts first at the lower half of the body, and then eventually goes to the upper half of the body. Then you see benign, well, not then, these can happen at any random sort of stage. They don't have to be in the way I've written them down. There's also benign growth, production of benign tumors like warts, cysts, polyps, fibroids. Something like BPH is considered a psychotic reactional mode in uh, homeopathy. And then eventually we get to chronic catarrh of mucous membranes. That means these are the patients that say, I have chronic postnasal drip, I have chronic bronchitis with phlegm, I have chronic yeast infection, or I have chronic discharge vaginally, which does not get better, and it's continuously draining. So it seems like it's a way of the body to get rid of things. And then eventually there is depressive tendency because of the nature of psychosis. The nature of psychosis is a person who was healthy and good, and all of a sudden has gotten all these abnormalities. And I'll give you an example in a second. These are the medications that we use more often in psychotic reactional mode. Thuja occidentalis, merorinum, which is the homeopathic dilution of gonorrhea, nitricum acidum, which is nitric acid, causticum, natrum sulfuricum. These are our main medications for psychotic reactional mode. Now, if we are looking at a psychotic reactional mode, just so that you guys can see, let's say in 2000, something happened to them. They go through divorce, or maybe I give you the example of one of my patients who had moved to California uh, with the hopes of becoming an actress, and she was, the model type, skinny and tall and happy, and so she came to California. She had an accident, and the other person lied, and because of that, she lost a lot of money, and then she lost a lot of different things, and her life just wasn't the same anymore. So after 2 years, she started gaining weight a little bit. And then the weight gain increased a little bit. And then after a while, she started having cellulites in her legs. And then the weight gain and the cellulite continued. She started getting bronchitis here and there and having abnormalities. And then a little bit later on, all of that continued, and she started having rhinaria and sort of eventually a postnasal drip. She started having warts and other abnormalities on the body, and eventually we figured out that she has gotten postnasal drip. She has chronic phlegm. She has cellulite, weight gain, and uterine fibroids. And um, the sort of you can appreciate that a person who was a model type and now um, she gained 50 pounds in the whole time that before seeing me. And obviously when you look at you look at tests in this person, you see no abnormalities, no thyroid abnormalities or anything else. So this is psychotic reactional mode, where a person starts putting on weight and cellulite and sort of having benign growths and warts and fibroids and then having a chronic catarrh of mucus of one of the mucus membranes. It's a way of the body trying to get rid of things, but obviously now the elimination pathways have been blocked, and this body cannot eliminate as much as it should. So it sort of puts on everything else. And that creates a depressive tendency, sort of, because when they look at themselves, they've completely changed. The other the reactional mode that Hahnemann discussed was syphilitic reactional mode. Syphilitic reactional mode is important because a body that has that's in syphilitic reactional mode will destroy itself. So it's a destruction and dystrophy and laxity of tendons and ligaments. So you see things are sort of uh, getting worse and worse, ulcers, and then ulcers get to necrosis. And then they usually complain of bone pain at night as well. This is one of the symptoms that they have. Autoimmune conditions, bone deformities, cancers. So this is sort of the syphilitic reactional mode. It's a little bit worse than, obviously a lot worse than the other two that you see. So in homeopathy, we use syphilitic reactional mode medications, but other treatment modalities are necessary because of the complexity and the uh, amount of abnormality that this person has. Obviously, getting rid of an autoimmune condition, bone deformities, or necrosis and stuff like that. Some homeopathic medications work, but at a certain point, this person needs a little bit more attention. So this is where we share a lot of our patients with allopaths and with other modalities, because that's the time that the homeopathic medications might not be enough. Syphilitic reactional mode meds are the mercury medications, so you can appreciate what mercury does in the body if we get exposed to mercury. Orums, which are golds. We have a couple of orum medications, orum metallicum and orum muriaticum. Fluorics, if we get, the side effects of having too much fluoride, those medications for us are considered syphilitic, and syphilinum, which is syphilis itself. So you can appreciate, the pathophysiology of syphilis and everything that it does to our organs. That's what we're talking about when we talk about a syphilitic reactional mode. So it's different than psoric and it's different than psychotic because of the fact that it destroys itself. It causes damage to everything, and these are patients that need a lot of help. There is a more recent reactional mode that Hahnemann did not discuss. This reactional mode is called tuberculinic reactional mode. Tuberculinic reactional mode is a subset of psoric reactional mode. If you remember psoric reactional mode, it's the one that eliminates, uses the elimination pathways to eliminate. So tuberculinic is an eliminator. Tuberculinic is actually a fast eliminator. And I'll tell you what it means. They are hypersensitive to cold. They are tired and they have a weak constitution. They're prone to more ENT infections and more often. So these are fast eliminators. That means instead of, the picture that you saw from John and Elizabeth, which was, they get this and it goes away and they get that and it goes away. You get, your 8, 9-year-old who goes to school, let's say on Monday, comes home Tuesday, he or she is sick and then has to stay home for a couple of days and then goes back to school again Monday, Tuesday, they're sick again. So this is a person who gets a lot of infections because of um, their weak constitution. They have lymphadenopathy, obviously, because of all the infections that they get. They're sensitive, they're nervous, they're anxious, and they're irritable. They're sort of hypersensitive to cold, which tells us that there might be some thyroid abnormalities. And sometimes when we look at lab values in some of them, we see some thyroid issues. So tuberculinic reactional mode is a subset of psoriatic reactional mode. So they use the same elimination pathways to eliminate. It's just that they are more cold sensitive, they're tired, they're weak, they get infected a lot, they're sick all the time, and they have lymphadenopathy and so on and so forth, sensitive, nervous, and anxious, and irritable. So as I talk about these things, maybe, a patient comes into mind, or sometimes, like I and in, we all have the medical student syndrome where we look at something and we say, oh my God, maybe that's me. And so maybe you can put yourself into one of these groups of psoric, psychotic, tuberculinic, or syphilitic um, as well, or someone who you might know might be them. Our main tuberculinic reactional mode medications are natrum muriaticum, which is sodium chloride, sea salt, tuberculinum, which is from tuberculous, pulsatilla, phosphorus, which is phosphorus, sulfur iodatum, arsenicum iodatum, and calcarea phosphorica. An example of this, of tuberculinic reactional mode, can be a 3-year-old boy who has had 4 runs of antibiotic per year based on ENT infections, very cold sensitive and weak immune system, then later on starts having skin infections, digestive abnormalities, and so on and so forth. But so you see, instead of them having like 1 infection a year or 2 infections a year, they say, over the last 3 years, this patient has had 12 rounds of antibiotic. You can tell that this is a tuberculinic patient because whatever comes into contact in their body, their SORA, or their elimination pathway is faster. So, but they're also weaker. Their immune system is weaker. So they get infected faster and they have to eliminate faster. So that's why they're continuously sort of sick or recurring illnesses. If you like to know more about any of this, obviously, as I mentioned, CDH has an amazing course, because eventually we can get into it, and there's more. There's some mixed reactional modes, like pseudotuberculinic reactional modes, and there are pseudo-psychotic reactional modes, and psychotic tuberculinic reactional modes. So there are other modes, and if you remember earlier on, I mentioned that Hahnemann said there's individualization. No one should be subject to be put in any of these modes. We just put them in these modes to figure out how we can help them. We can help their physiology, and by giving them a proper medication from the lists that I showed you, we can help them. And the way we help them is we help them to have less often symptoms, and also uh, when they have any of their symptoms or illnesses or eliminations, they have it less, so the duration will be less. So we use homeopathic medication to make sure that our patients don't get antibiotics a lot, and antihypertensives and anti this and anti that. We try to use homeopathic medications as much as we can, so we decrease the reliance of other medications, because as I mentioned, adding foreign particles to the body can affect the immune system, and the immune system or the body can go into sort of becoming a psychotic reactional mode, which is not where we want to be. I'm going to switch gears now. We talked about miasms and sort of physiology of the body. Now we're going to talk about morphology and connective tissue. This is another way of looking at a constitution. And in clinical homeopathy, we call this constitution. People are also either fluoric, phosphoric, or carbonic. Again, mixed types are there as well, but the basic three groups are fluorics, phosphorics, and carbonics. Fluorics are the lax ligaments, double jointed. These patients can be short and thin. There's asymmetry of the face and of the body. There's dystrophy of the skeleton. There's a scoliosis. When you look at their body, their x-ray, there's exostosis. You look at their teeth, they're deviated. So these are the people we call double jointed. So their connective tissue is lax, and because of the fact that their connective tissue is lax, they will have abnormalities as they go through life. And obviously, Marfan or Ehlers Danlos are homeopathically considered a fluoric constitution. Then we have the phosphoric constitution, which they have normal ligaments. They're tall and thin. They deal with some inflammation throughout their life, sinuses, digestive or lungs. They tire easily, but they're also active, and they get mood fluctuations where at times they're sort of hyper and doing things and getting things done, and other times they sort of need to sit down and relax. But their connective tissue is normal. Then we have our carbonic or tight ligaments. This specific constitution can be short and stocky. They can be heavy or obese. So you can appreciate as they age, they get sclerosis because imagine, your heart is beating against a aorta, which is very stiff the whole time because of the fact that the connective tissue are very tight. These are the people who can't touch their shoulders, can't bend down and touch their feet or the floor because of the fact that their ligaments, their connective tissue is tight. So when we talk about constitution here, fluoric, phosphoric, and carbonic, we're talking about laxity of everything. We're not only talk about ligaments. Of course, the fluorics these are the kids who get a lot of sprains because their ligaments are lax as they grow up. But as they age, imagine this is a person who eventually will have babies, and you can appreciate the amount of force on the connective tissue of the vaginal walls and sort of the digestive system and the uterus itself. And you can appreciate that things sort of start moving. And these are the people who will have laxity, they'll have ptosis, they'll have issues with, well, not carbonics, obviously. Carbonics are tight ligaments. I'm talking about fluorics. So fluorics will have abnormalities where things are sort of a little bit or a lot too loose. So because of the laxity, they will have abnormalities. They can have vaginal prolapse or anything else just because of the facts that the connective tissue is too lax. And then with carbonics, as I mentioned, the tightness of the ligaments is the problem. So they get their abnormalities because of tightness of ligaments. So these were the way we look at a constitution based on morphology and based on body type. I'm going to go back to carbonics. Carbonics with tight ligaments. These are, you look at their teeth. It looks like it's the piano keys. They're so nicely cut and they're sort of square. You look at their X-ray, you see the lumbar spine. The vertebrae are square and really nice and put together. The carbonics are slow and methodical and they're meticulous. Like you give them something to get done, it gets done amazingly. It just gets done a little bit slower, and they're slower in sort of milestones as well. as they age, they walk a little bit slower and they get their periods a little bit later in life, and so on and so forth. So they're usually constipated because of this connective tissue tightness and stuff. So when we look at a morphology or connective tissue, we sort of look at a person homeopathically and try to put them in these three categories of fluoric, phosphoric, and carbonic, and figure out if we can see their futures. We figure out if there's anything we can do so that in the future they don't have these specific abnormalities that we discussed. Another way of looking at the body now or constitution now is considered sensitive type. Sensitive type is very interesting and very important. It's based on three characteristics. There's physiological and pathophysiological susceptibilities. There's behavioral and emotional tendencies, and physical and morphological characteristics. What does this mean? That means maybe you guys have heard, and if you have a homeopath friend, they might tell you and they say, well, I think you're Lycopodium, or I think you're Pulsatilla, or I think you're Sepia. And all that means that there are certain physiological susceptibilities that, let's say, a sepia has, and also some pathophysiological tendencies that they have. So we can tell a sepia will have the specific issues, like they will crave acidic food, but they will have digestive abnormalities, and they'll have constipation and so on. And so we know their pathophysiology. We also know their behavioral and emotional temperaments. We know that they like to be left alone. They're people who don't want to be consoled, and they're indifferent as far as emotions and behaviors and conversations are concerned, and they have a specific physical and morphological characteristics. We know CPS are going to be a certain height, they're going to be darker, they're going to have sort of cloasma, they're going to have specific smell to their body and all of that. So in homeopathy, a sensitive type is a specific set of clues that tell us what a patient is. For example, I'm going to sort of bring to your attention Lycopodium. Lycopodium is one of the psoric reactional mode medications. We see that when we look at the Lycopodium and we ask about when they were a kid, the parents will say, well, started having some eczema, there was some vomiting that smelled like acetone, and then there was some anorexia, and it seemed like as a kid they had some tics, and then later on, when we get to know them, they complain of having, flatulence and having bloating in the abdomen that is really bothering them. It's usually where they wear their belt, so it's below the navel. They can get red sort of after the meals and have distended abdomen whenever they have food. They feel tired right as soon as they have food and they need to take a nap. And then if we wake them up from the nap, they're actually groggy, as opposed to other medications that we have, like Nox vomica, who will feel the same way after they eat, and then they fall asleep. But once they get up, they're refreshed and they're ready to go. So Lycopodium will wake up and say, we always say you never wake up a Lycopodium from their nap, because they're going to be groggy, they'll be angry, and they won't treat you well. There's pyrethrosis, they'll have migraine headaches. So we know Lycopodium will have migraine headaches, especially if they miss a meal. Lycopodiums have to eat breakfast, lunch, and dinner at a specific time, like 8 a.m., 12 noon, and then 6 p.m., and that's how it's done. If that is moved a little bit, they start having migraines and vision abnormalities. They'll have biliary dyskinesia and lithiasis, so they might have lithiasis, they'll have duodenal ulcers. Um, and the urogenital system, there is reddish crystal-like sediments, there is lack of libido, there is lithiasis of the kidney. So we see lycopodium as a stone former, um, because of the fact that you see lithiasis almost in two, you see it in two different organs there. On the skin, they'll have all sorts of eruptions. They'll have, but these skin abnormalities will be very itchy. And what they like to do is they itch and itch. So they sort of scratch it until it bleeds. And once it bleeds, it actually feels good and they stop scratching it. So sometimes a lycopodium comes to your office and you look at it, complaining of skin abnormalities, and you see these streaks on their skin. And then they say, yes, I itch. And then as soon as it bleeds a little bit, it feels better. So I stop. So those are sort of the physiological, pathophysiological um, tendencies of lycopodiums. There's also behavioral and emotional tendencies. And lycopodiums are shy internally, but they have a facade that is very proud and authoritarian, very funny, very intellectual. They have amazing memory and um, they know a lot. Um, with lycopodiums, though, we can't contradict them because you contradict the lycopodium and they get angry right away. They get upset. They actually get red in their face. You can see it right away. They get red and they will have the last word. They'll sort of respond to you um, the way that they want to. Then we look at physical and morphological tendencies. Lycopodiums uh, gray very early. They age very quickly. And these are people who have, so if we're talking about the physical morphology, they'll have a round chest, like a round torso. Their arms and their legs are going to be underdeveloped. They're not going to be very muscular, but the torso is going to be big. They're going to have gray hair early. They're going to have the uh, sort of bronze spots on their skin. They'll have skin that is very dry. They'll have uh, sort of these skin flakes and stuff that comes off. Um, they will have, sometimes they'll have facial tics, you'll see it. And then they are prone to hay fever. So you might know a lycopodium that stands there, and as they're giving lecture or they're talking to you, they get into sneezing fits, or they get rhinaria and they can't stop. The rhinaria sort of goes on and on and on. So they're prone to allergies, skin, ENT, and you see they're prone to digestive abnormalities and certain behavioral and emotional tendencies. So a sensitive type for us is an individual who has all of these things. That means um, a lot of the times your homeopaths will tell you and say, I can read you like a book. And then they're absolutely right, because we know the homeopathic materia medica of lycopodium. I just gave you sort of a third of the what's written into materia medica, or a fourth of what's written in materia medica for lycopodium. There is a lot more, obviously, and sort of it gets a person who wants to know a little bit more to read the whole thing. But we know the sensitive type of a lycopodium. I just gave you sensitive type of sepia a little bit earlier on. There's sensitive type of Nox vomica. There's sensitive type of phosphorus. And so based on um, what we see from a patient, what we ask from a patient, and their physiological, pathophysiological, as well as emotional, behavioral. And when we see them in the office, a lot of the times, most of your homeopaths who are good with sensitive types and good with materia medica, within the first 1 or 2 minutes, 3 minutes of talking to someone, they know what your homeopathic type is, because we have all of these things sort of memorized or have seen it multiple times in our patients. Sorry. So I thank you for those of you who have stayed with us so far. The I'm going to review this one more time. So when we talk about constitution in clinical homeopathy, we're talking about three things: elimination pathways, constitution, which is morphology and connective tissue, and sensitive type. So uh, if you remember, elimination was Soric, reactional mode, which were the eliminators, but always things come back to normal. Tuberculinics were a subset, were just fast eliminators. Um, the weaker people, weaker immune system, but those also always come back to normal. They just had more adenopathy. They were cold sensitive. Then we had psychotic reactional mode, which is the pathways that don't eliminate properly. So they put things on like benign growths and warts and eventually chronic catarrh and then depressive tendency because of that. And then syphilitic reactional mode, which was the sort of destroyer of their body. So they basically destroy their body. We had constitution based on connective tissue, which was floric, who were double jointed, and laxity of tissue, laxity of bones, scoliosis, exostosis, phosphoric, which were the normal um, sort of connective tissue, but complaining of inflammation. Carbonics, who were really tight connective tissue, and they get their abnormalities because of the tight connective tissue. And then the sensitive type, which was based on looking at someone based on their physiological, pathophysiological tendencies, behavioral and emotional patterns, as well as physical and morphological, the way they look. We can tell what sort of homeopathic type or sensitive type they are. So when we say constitution in clinical homeopathy, we're looking at a lot of different things to figure out someone's true nature, and this is what we do, and based on what we find, we give them a medication. One of the medications I explained or I showed you earlier on, and those medications are supposed to um, help with elimination. They're supposed to help with the patient's physiology to like when we get a sensitive type um, medication to someone, um, let's say for a Nox vomica. Nox vomicas are bossy and authoritarian, and they go to sleep and they have a hard time falling asleep, and then they wake up around 3 a.m. and they have professional worries and they have a hard time falling asleep. So they look at their cell phones for a while and then they eventually fall asleep only to wake up in the morning, and now they haven't slept. They need coffee, and then they get to work and now they have headache. They need Tylenol. So we sort of know the pattern of a Nox vomica, and for that reason, we give them a homeopathic medication to decrease this pattern so that they rely less on um, medications, caffeine, alcohol, and cigarettes, tobacco. These are the things Nox Vomicas do a lot. They're sort of the type A personality, CEO of companies who are running multiple people. So all of that we see. So when we give a sensitive type medication or a reactional mode medication, it is to help the person to have less often their abnormalities, and we're basically encouraging their physiology and their emotions. Change gear a little bit, and I'll take your questions in a while, but you know that homeopathy has been regulated by FDA in this country since 1938. And we know that homeopathics are not remedies. Homeopathics are medications. When you look at homeopathic medications, they actually have what's considered the FDA's drug number on all of them. So I know a lot of us have been sort of used to calling homeopathy a remedy. Homeopathy is not a remedy. Homeopathy is a medication and should be treated as such. Um, this was very interesting. I found recently. Globally, medication-related issues contribute to a significant number of deaths each year. The World Health Organization estimates that medication error causes at least 1.3 million deaths annually worldwide. In the United States, study of Johns Hopkins suggested that medical errors, including medication-related issues, are a third leading cause of death, contributing to 250,000 to 440,000 deaths per year. And and a $42 billion annual uh, sort of loss. But this is very interesting because when we see a 1.3 million death annually worldwide, and if we go with the smaller number in the United States, which is 250,000, this means 20% of the worldwide medication error death happens in the United States. Just going to leave you with that for a second. It was interesting to me. Now, deaths directly caused by homeopathic medications are extremely rare. As a matter of fact, they're so rare that I searched and I didn't find anything, primarily because homeopathic products are heavily diluted and often contain little to no active ingredients. However, harm can occur when people rely on homeopathy instead of proven medical treatments for serious conditions. So a lot of the times, issues with homeopathy is because the patients delayed medical conditions. And one of the things that we teach in CEDH is your homeopathic medications are yours to use as a first agent, as an agent to be combined with other medications and be used with other medications as needed. So if we have a patient who has chest pain that feels like heart attack, we'll send them to emergency room. We don't try to give them cactus, which is the homeopathic medication of chest pain. So it's important to make sure that they don't have a heart attack first. And then once all the results are done and we know that there's nothing going on with them, we can give them the homeopathic medication for symptom relief, if that's the case. Not to say that homeopathic medications are not strong. Homeopathic medications are amazing. They have done certain things in my practice that no medicine could produce. And nowadays, I see a lot of patients coming to see me because medication failed, obviously, and they're there to see me. And one of the things that I use is homeopathy. Just to tell you that there is a lot of benefits with homeopathy if used correctly, and you have no fear of causing any abnormalities to anyone unless you really medically treat them abnormally. There's a lot of research in homeopathy in recent years. If you remember, when we say illness specific to the individual, it makes it really hard for a double-blinded study, because as homeopaths, we have to know the symptoms of the patient to give them the correct medication. There is 20 sinusitis medication in homeopathy. We can't choose between the two and say one is better than the other one. That doesn't make sense in homeopathy at all. However, because of the fact that we have other ways of doing research, nowadays we have more research coming out. Now we can look at nanotechnology and all these other things that's giving us a lot of information. This was one of the recent studies, EPI3. This was done with 8,559 patients. And this was patients sort of going to GPs, going to conventional medicine, going to MX, which is a mix of GP and homeopathy, and going to homeopathic physicians alone. So a lot of doctors involved. Obviously, you can see a lot of patients involved. And this was a cross-sectional study in musculoskeletal disorders, upper respiratory tract infections, and sleep disorder, and anxiety and depression. And for most of these things, they showed that two things. Number one, the patients who went to homeopaths, the patients who went to GPs who were also homeopaths did better than the other groups. Patients that went to homeopathic groups and GPs who did homeopathy used less medication, had the same outcomes. They only had less medication side effects. This is another one, homeopathy research for back pain. This was a 2-year follow-up study. And this one showed the severity of the diagnosis and complaints showed marked and sustained improvement. Quality of life improved accordingly. The use of conventional treatment and health services decreased markedly. The number of patients using low back pain related drugs was half of the baseline. So you see that with homeopathic medications, you can actually do a lot of good with your patients. Arnica, everyone knows, It's important to sort of see this research on arnica. This was on gene expression in a human macrophage cell line. And it basically showed us how um, what we had for arnica, where you see a lot of the uh, plastic surgeons, you see a lot of surgeons actually use arnica because it regulates inflammation, it causes tissue repair, and it causes angiogenic activity. So it really heals the area if we want to use that word properly. So it's important to obviously you guys know arnica. I'm slowly going to bring this to an end. We'll give you a couple of concepts. Number one, um, I practice homeopathy and osteopathy and family medicine at a time, and I was working at urgent cares and emergency rooms. But we always have to remember that there's limitations with anything. There's limitation with osteopathy. There's limitation with homeopathy. There's limitation with medicine. There's limitation, name it. So um, I'm not trying to make you guys think homeopathy is the cure-all and or it's the only way to go. It's one way to go. It's one way to help your patients. It's a way of giving your patients medications that will not cause side effects. And eventually, if it doesn't work, you will give them the allopathic medication. So if any of you guys are interested in knowing more about homeopathy or to take courses on homeopathy, you can please contact me directly. But again, one of the reasons, I'm going to go back for a second. One of the reasons that homeopathy lost its mojo in the United States was because um, a group of people who were not doctors, and I don't mean it in a bad way. I mean, they didn't even know medicine. Nowadays, we have nurse practitioners in our classes, we have physician assistants in our courses, and DOs, MDs, but there were people who were not even of a professional background that learned homeopathy and started promising people the world. And that failed because these people failed. They didn't know what they were talking about. They didn't know the consequence of cancer, the consequence of heart attack, the consequence of infections. So that's one of the reasons homeopathy failed. The other reason was certain homeopathic doctors, one of them called Kent, obviously, sort of combined homeopathy with spirituality and adding sort of uh, spirituality to the mix. Spirituality is always part of life, part of healing, and we know the power of prayer. The studies are there. Look at Joe Dispenza and all these other amazing people who have used their spirituality. But I think at the time, the terms he used and the way he tried to explain homeopathy through energies was wrong. Nowadays, we have more information. We have research. There is a research by Dr. Luc Montagnier who showed homeopathy working through frequencies. So we can talk about those terms, but now more specifically and more professionally because they're all done by research. But at the time, it's lost its mojo because of those specific reasons. And some people say because AMA was formed to put down homeopathy. I haven't done a research on that to see if that was the case or not, but it doesn't really matter. We want to bring back homeopathy. So again, if you're interested about the course, CEDH is where I teach for. And it's an amazing course. You know, it's divided into modules, teaching you the best parts of homeopathy so that you can use it the next day in your office. I have some homeopathic information on my YouTube. Our YouTube is Body of Harmony. We've done a bunch and then we stopped for a while, but now we've hired somebody else to help us do more videos. So we're going to continue doing more videos. If you like to know any specific things with homeopathy you like me to make a video, please do tell me and I will create that for you. But you can go to YouTube and find some more information about the lectures. I think I have a lecture on acne, on anxiety, on insomnia, low back pain. I have a combined low back pain of osteopathy and homeopathy that's really good. So those are sort of worth looking at. Samuel Hahnemann said, the highest ideal of cure is the speedy, gentle, and enduring restoration of health by the most trustworthy and least harmful way. And I think this is really important to keep in mind. I want to thank
Well,
Dr. Bill
we want to thank
um,
you. That was fabulous.
uh, and Dr. Halasa for giving us CMEs and supporting us. You guys, and thank you all for staying with me through the end of this. If you have any questions, I'm always there. My information, I'll take your questions now, but this is my information. If you want to contact me directly and ask me questions, please do.
Okay, that was outstanding. One question here. Uh, can you name any classic compendiums of homeopathy? Some of the like the tried and true books that you use.
Oh, the books on homeopathy.
Yeah. Mhm.
Um, I use specifically our homeopathic materia medica, which is done by CDH, just because of the fact that it's a clinical homeopathy. That means there's toxicology and pharmacology, and
Mhm.
it's been vetted multiple times. That means the course goes, the materia medica goes through the teachers that teach homeopathy with CDH, and then we cross out things that don't work anymore or things that we haven't seen working anymore, and things that we see have worked we actually highlight in the book. We sort of put it in bold faces. So it's a lot of good information for that. We also have a couple of we have a lot of different books, but like if someone wants acne or if someone wants menopause or something else, we have specific books directed at those things. If there's anything specific, please email me and I'll find the best book for you and send it to you.
Okay, that was okay. That was great. Dr. Nario, do you have any online questions?
Yes, yes, Dr. Pam, that was an awesome lecture. Thank you so much for that. I think what
Thank
you
you.
were pertaining to in relation to closing out of the homeopathic foundation was part of that. It would be the Flexner report. And that was actually one of the reasons why homeopathic schools were kind of eliminated, as they, of course, wanted to divert everything towards the allopathic standards. And yeah, again, I'm also a practitioner of what you're doing, and this is such a great input that you gave. And in terms of this is a different look at constitutional homeopathy, because I was trained towards the classical constitutional approach,
Right.
and Dr. Wolfier also is one of the better ones to vouch for homeopathy in terms of his own practice. But one of the questions that comes to my mind is there are classical homeopaths and also there are like modern homeopaths now in terms of the conflict of using single remedies versus multiple remedies on a patient. So what is your stand on that?
There is no the whole point is to appreciate the patient as a totality and to appreciate them as um, an individual who has the illness. So an individual who was healthy and happy at a certain point, the physiology was working fantastically, and then all of a sudden that physiology is no longer working the way it's supposed to. So it doesn't matter if we're giving one single remedy or we're giving three remedies and we're accomplishing as long as and if we look at history, we see that Hahnemann himself never gave one remedy, or I guess they call it remedy because you did one medication, and then kept that one medication for months. Hahnemann gave medications and brought back his patients every 3 or 4 days and changed them sometimes, right? But obviously, he had 46 medications to work with, and now classical homeopathy has more than 1,000 medications to deal with. So just to know that we we do not need to sort of force patients into a specific category. We can always bring them back, redo our consultation, redo our interview again, and come up with the best medication at the time. Because as you've noticed, you give someone a sinus medication, and in 2 or 3 days, they don't have the bloody discharge anymore. So now the medication has changed. It's not going to be exactly the same thing. The medication needs to be changed. If we're talking about the so those are acute. If we're talking about the constitutional medication of a patient, as long as you can get closest to, because we're always getting close to, there is no one who's going to be 100% lycopodium or 100% anything else. But we're trying to get as close as we can to a natural substance that will encourage their body to be better. And as long as you can do that, if you can get it done with one medication or you can get it done with 3 medications, I think you still are doing fantastic with your patient.
Right. Well, one of the theories that I've heard of the reason of multi-therapy would be more of the toxicities of the newer world that we live in. So, which actually kind of makes sense to me that the single remedies worked before just because of the exposure is not as intense or multifactorial. But now with multi-remedies, that also can now factor in the evolution of the world where we have different toxicities, as you mentioned, and also different sources. But yeah, that actually makes perfect sense.
Yeah, we were at a Homeopathic International Congress. I think it was the fourth. It was the fourth international congress in France. I'm forgetting which city. It doesn't matter. So one of the things that they showed, and it was interesting to see, is that now, because of the fact that the soil has changed and because of the fact that we're exposed to more environmental toxins, we are seeing more psychotic reaction on more patients than we were seeing before. So we know that all of these toxins and everything else is affecting us. And obviously we know it in functional medicine and we know how to deal with it. But to see that there are more patients who are psychotic reactional mode nowadays than before, it's very interesting.
Right. And also, as you mentioned a while ago, that reassessment is key here. That whenever you give a remedy, then the patient does shift to a different, for example, constitution. And as you mentioned a while ago, when you describe lycopodium, you basically kind of describe also signs of low testosterone on a patient, like when they
Right.
actually are less muscular and they look older. So that's why now, when you, as you mentioned in your practice a while ago, it does make sense that there are actually is a time and place for integrative interventions that are non-homeopathic to basically help the patient, because there are straight homeopaths out there that are kind of against this mixture. So I'm not saying against, but maybe they still stick with their fundamentals. But in your experience, because that's also one of the questions of our viewers here, how do you see success in mixing the allopathic remedies with homeopathy, and how do you sequence that? Do you finish one first and then insert the other, or the same?
Well, a lot of the time, if let's say someone, and it depends on the case as well, how acute it is and how bad it is. You have someone who walks in with a urinary tract infection, and you're worried that it's going to become a pyelonephritis. mm, I'm gonna give them the homeopathic medications for symptoms of burning and fevers and everything else, nausea or anything else that they have, but they need their medication to make sure it doesn't become pyelonephritis, right? So it's the acuteness of the patient. And then you have somebody else who walks in and they have something else like a sinus infection. You don't treat sinus infection for 2 weeks, it goes away on its own. What if we pour homeopathic medications on it, the proper homeopathic medications on it? And remember, whenever we talk about homeopathy, using homeopathic medications, we're also uh, educating our patients with environment. That means you tell them take the vitamin C and the garlic and the onion and uh, wash your nostrils. So you bring about the environment that gets rid of sinus infection. So we will have that. And why don't we try that for a while? And if it really failed, I order the medication to the pharmacy for my patient and I say, pick it up. If within 3 days the homeopathic medication didn't do the job, take your medication, take your antibiotic. Why not?
Do you
But
do overlaps?
if I caught the chance of you taking antibiotics 3 times a year to once a year or none a year, that's good. I've done something impressive, because now in my books it says this is a patient who used to get 4 antibiotics a year, and now for the past 5 years that they've been with me, they've had no antibiotics. That's
Right.
impressive.
Do you do overlap, like what when they're on homeopathic remedy, then you do an allopathic remedy on top?
Yes, sometimes I do that, and then depending on certain allopathic medications, we want to stop. We start a homeopathic medication, give it time to work, and then slowly get rid of the allopathic medication. So it depends. Each person is different based on what they're going through.
Right. And it was interesting how you presented miasms, because there's of course there's some variation in your explanation, but I really can always remember miasm as something that was passed on genetically, even in generations, in terms of why you're actually getting that susceptibility. But in relation to your explanation there, that definitely is another good approach to view it in relation to treatment. And I think
Oh,
one of the questions here also is, I don't know if they're asking for your cheat sheet here, but I don't know if you've seen these programs wherein you punch in constitutional symptoms, it will generate a remedy for you. They're asking if you ever use that or any recommendations in terms of those programs or algorithms.
Um, sure. I'm going to answer that, but I'm also going to touch on your point on miasms. Um, Hahnemann also said miasms are inherited. And when we look at even when we do our homeopathic interview, we always ask family history, because we think psoric parents will produce psoric um, offsprings, and psychotic parents will have a higher chance of having a psychotic offspring. So we know that, um, especially as Hahnemann described it, it is a genetic and environmental factor, sort of acquired factor that comes together. So even at his time, and the reason I give him a lot of props is because at his time, before people figure out what's gonorrhea and chlamydia and syphilis, he knew the difference between, and he was telling people how different they are from one another, as well as talking about illnesses being genetic as well as acquired. So just for him to think about that at that time and age, I really appreciate it. Your point about repertories. Repertories are really hard to deal with, because you type in all this information, and at the end of it, they'll ask you more question, and then they'll come up with multiple medications, and you still have to go back to Materia Medica and figure out and see which one of these medications are the ones that you're going to use for your patient. So in clinical homeopathy, we try to know the basics of each medication so that we can almost by memorization bring about a group of medications and then go towards it. So instead of putting it in repertory, we put it in our brain or memory sort of pathways and try to cross-link things together and figure out what's going on.
Right. Well, just this is probably from your last slide. You mentioned about the homeopathy being a medication. So I guess they were asking, how come this is not something that needs a prescription? Or basically, can you, because you can, like, for example, your product that you presented, I think you're promoting, you can get it over the counter. I mean, that's maybe a question out of curiosity and maybe related to your last slide.
Some medications actually need prescription. Medorinum, Sorinum, Tuberculinum, homeopathic digestion of coke, which is coca. Certain medications definitely need a
Opium, I
prescription.
think, right?
Opium, exactly.
Yep.
So these are the ones that actually need prescription, and they're not going to be out there. However, when HPUS, Homeopathic Pharmacopoeia of the United States, was put together, homeopathy was considered at the time, because of the fact that it was very diluted, as something that could be used as a food, if I remember correctly, and therefore it was over the counter like any other over the counter medication, right? So like your Tylenols and sort of the rest of the medications that are over the counter, a lot of the homeopathic medications are over the counter because of the fact that they have no side effect. The ones that you see over the counter have no side effects, basically, in the dilutions that they are. If they get into the mother tincture or the less diluted, they will have an effect because they will show effect more. So that's why a lot of the medications, homeopathic medications, are over the counter, just because traditionally since the 1900s they have been over the counter, right? And then, but the rest of them need prescription, and those are not the ones that you'll find anywhere on Amazon or anywhere else.
Right. I think mostly no-sodes are the ones that needs prescription. And then here's an interesting question. What are your thoughts on these? There are products out there that are basically claiming it's COVID-19 homeopathic remedies. Do you have any experiences with this?
I don't have any experience with it. We used certain medications because our group CDH, we sort of looked at all the cases around the world because, as I mentioned, CDH is in multiple countries in Europe and United States and Canada, and we noticed that the medications that we used more often were Mercurius solubilis. We use argentum nitricum. We use phosphorus a lot, and so we actually had a list of all homeopathic medications to use specifically for COVID. Arsenicum album was another one. Gelsemium was another one. So if you remember, one of the slides that I showed that a natural substance has to first be experimented. Experimentation is COVID. We get COVID. We know the side effects or the symptoms. Then it has to be, so that was the proving. And then the experimentation is where you give it and see if it works. That means your patient who has abnormal is presenting with symptoms, you give it that medication in homeopathic dilution, and you see if you can check mark all the boxes that it relieved all those symptoms, right? I don't think we have any experimentation. We have proving on COVID. We know what COVID does. We have no experimentation to see if the homeopathic medication that they've used for COVID is working or not, right? So that's why I have not used it, because it's like you also don't want to use something that is, you want to use something that has record. You want to use something that the whole point of homeopathy, it's the fact that it's an experimental medication. That means throughout time with experiment, we know what medications work. So that same thing with Persian, like in my family, certain things we know how they work because we've used it for so long, right? There are no experience. We haven't done any experiences to see. So experimenting with these things is a little bit scary, especially with conditions like COVID. Unless someone really does a study or a complete experimentation and tells us that these things actually worked, then they'll probably make it somewhere. They probably won't make it to HPUS anymore because that's closed, but at least some of us will have more information about it. But I haven't seen that information.
So to our viewers, Dr. Payam just describe how homeopathic remedies go through clinical trials. So it's not like phase 1, phase 2, phase 3, like how drugs are done, but this is kind of like how we do it in the homeopathic world. But Dr. Payam, again, thank you so much for the great presentation. You got all my questions out, and hopefully we can get you back on board again with your great lectures.
It'll be an honor. Thank you guys very much.
Okay, thank you, Dr. Payam. Thank you, Dr. Hakimi. Anybody else have any comments or questions? Next week we have the incomparable Lisa Talati again from New Zealand. You remember her? She was the ultra marathon runner and transformed into the super caregiver for her mother. And she's going to, and I know Dr. Nario was on with her last week. So she's going to give us more tales from the superstars, the super fit humans. So we'll see her again next week, same time, same station. I have in the chat the link for the CME credit, and it'll be on next week's email. Anybody have any comments, questions? If you have any anything you'd like to present? You know, we're always looking for presenters. There are quite a few new people on here this week. We welcome to have you. Thank you, and please come back. We're here every Tuesday night at 8 p.m. Eastern, 5 p.m. Pacific, same time, same station, same link. So we'll see you then. Dr. Hakimi, great as always. And like we always say, if you're if you do us right, we'll invite you back. Otherwise, we don't bother you. Okay.
Thank you guys very much. You guys are amazing.
All right. Thanks. Good night, everybody. We'll have the video
Good night, everyone.
as soon as we can. And I'll have that over to you, Dr. Hakimi. Thank you so much.